This is going to be a real quick male reproductive anatomy talk. We've already looked at a lot of this anatomy, but starting from the primary reproductive organ, the testes, which is where the sperm are produced, also produces androgens. Sperm travel to the epididymis. Epididymis is where they store and mature. You have the ductus deferens, which is the tube that transports up. We travel through the inguinal canal, over the bladder. On the posterior side of the bladder, we pass around and then insert to the superior portion of the prostate. Around the side of the prostate, we have the seminal vesicles. Meeting up with where the ejaculatory duct feeds those two secretions into the prostate, we have the prostatic urethra, travels from the bladder down. We have this very short run of membranous urethra, and then the rest of the urethra is penile urethra. The bulbourethral gland secretes into that space. And then we're into the penis with its paired, with its actually triplicate structure of erectile tissues. The scrotum, external structure, essentially helps maintain the temperature of the testes, keeps the temperature lower than abdominal temperature for enhancing sperm production. We see a couple of different adaptations down in the scrotum and testes that help maintain temperature. So for example, if we look at the surrounding tissue, we find that in the scrotum itself, there's the dartos muscle, which is a smooth muscle. It can keep the scrotum itself closer to the body. And then surrounding the tissue that travels down from the inguinal canal to the testicle, you have the cremaster muscle. Take a closer look at that. So we have what's called the spermatochord. During development, the testes actually starts up into the abdomen and is pulled through the inguinal canal by a structure that's called the gubernaculum. In a mature male, that's actually called the scrotal ligament. What's left is this cord of tissue that together is called the spermatochord. And picture that it inside includes all of the things that the testes would need, like blood vessels. You have an artery that goes down in. You have the veins that take blood back. You have a nerve that provides the innervation. As we move further out, so picture that you have a testes that was pulled through a muscular body wall, and so it pulled muscle with it, which creates the cremaster muscle. Cremaster muscle can either, when it's cold, pull the testes closer to the body, or when it's warm, it relaxes and allows the testes to be further away. And then there's connective tissue that surrounds the outside of that cremaster muscle. In cross-section, we see that there's a single artery that comes down through a plexus of veins that are traveling back up. One thing to point out is that as that one warm blood vessel artery is coming down through the center, the multiple veins that are traveling back up allow the heat to dissipate from that artery, which would be abdominal temperature, into those veins, so that the blood that makes its way down to the testes is actually cooler than abdominal blood would be. Down in the testes itself, we notice that there's this lobular arrangement, and those lobules are called seminiferous tubules. Seminiferous tubules are the actual site of sperm production. So closer up in those seminiferous tubules, we would find around the tubule a group of cells called interstitial cells. The interstitial cells, so if this is a cross-section through tubule, we would find interstitial cells in this space in between the cells. Interstitial is a term that actually means in between. In the tubule itself is where we would find the spermatogenic cells, the one that make the cells that make the sperm. And you can actually see towards the lumen of this slide, there is a bunch of what look like little tiny sperm cells that are finishing their rounds of development. The penis, real quick. So the penis is external genitalia. So this is the portion that is responsible for depositing sperm in the female. So in class, this is what we call the turkey baster, right? So it's filled with a couple of different types of erectile tissues. So picture you have a urethra that's going through the penis, and we don't want to close that off. We want to make sure that that sperm and semen can travel through the tube. But we also need to make sure that, so it doesn't get closed off, we also need to make sure that the rest of the penis is firm enough to be able to be inserted into the vagina. So what we see are two different types of tissue. So corpus spongiosum surrounds the urethra. So it keeps the urethra open, doesn't allow it to get crushed, but it doesn't squeeze down on the urethra so that fluid can't move through it. On top, we have the corpora cavernosa, so paired bodies. And regardless of whether we're in the spongiosum or the cavernosum, what we essentially have is a spot where blood pools and fills. So the cavernosa, the blood fills in kind of tighter spaces and makes a much more rigid structure. Whereas on that ventral surface of the penis, you have the corpus spongiosum surrounding the urethra, and that allows the semen to be able to pass through the urethra, but it doesn't. It keeps it open during normal intercourse, so it doesn't get crushed.